have the courage to overcome any challenge. We show grace in our victories, have peace in the present moment, and excitement for the future. As we put on these white coats today, may we remember the expectation that comes with them, to strive for excellence in all that we do. I know that you will achieve excellence. You already have. The future is bright, but for now, let's be present in this moment and celebrate this wonderful accomplishment with gratitude. Thank you.
Thank you. Well, good afternoon. My name is Alison Morrison-Shetlar. I am the president of this amazing University of Lynchburg. And I'm pleased that we're concluding our third week of the fall semester by congratulating this incoming class of DPT students as you receive your short white coats. This is an extraordinary milestone in an extraordinary time. The white coat recognizes your hard work and the knowledge you have gained to date, and the work in which you are about to embark alongside your peers. It symbolizes your readiness to continue preparing to care for patients in a time when our country and our world need you the most. This DPT class was chosen because of what you bring to our institution, the hard work done to get to this point in your career, and your desire to continue to learn and lead. You would not be here if you had not shown that you have what it takes, that you are ready to take on the opportunities and challenges of this program. The university takes great pride in our graduate health programs. The importance and relevance of physical therapy in our community is incalculable, and I know that we train and educate the best and the brightest. So as you begin your career here at Lynchburg, you will be tried and tested. You know that your will, your resilience, and your fortitude will see you through, that you are committed to take on these challenges in service to others. And so, I wish you the best as you begin your DPT program here at the University of Lynchburg. Remember that when you're here, you are home, you belong, and you will thrive. You have highly qualified and passionate faculty from which to learn. Learn with an open mind and be ready to embrace our university's pillars that will guide you to success and distinction. Those pillars are leadership. You're already leaders, and this program will help you hone those skills as you take on leadership roles within this cohort and in the community. Make sure that you and those around you meet their maximum potential. Second pillar is collaboration and innovation. We work alongside our community members to support them to be the best they can be. You will innovate, look at things differently, and think differently due to innovative teaching practices of your faculty. The third pillar is justice, diversity, equity, and inclusion, and that is in the DNA of this institution. And you will learn about what that means within your cohort and the patients that you will serve. How to work with those that are different from you and identify the strengths and talents that make us all unique, yet part of an effective team. I look forward to being with you through your journey, seeing you grow and learn to meet your maximum potential. So, show your university spirit and please wear red on Fridays. It is what we do here at the University of Lynchburg. Congratulations to all of you. It is a great day to be a DPT Hornet.
Thank you, President Morrison-Shetlar. I was going to address the wearing red on Fridays. So I commend those of you that are wearing red today. You've been warned. You've been warned. Good evening. Thank you, family and friends, for your support of these fine students. They would not be here without you, and they know that. Matter of fact, why don't you all stand up? No, you sit. You sit. No, you stand up. My bad. You stand up. Got it backwards. Face them and give them a standing ovation. I remember during orientation how many of you shared the importance of them and you being here. So it's great that they're here to be able to honor this. I am Rusty Smith. I am honored to serve as the Dean of the College of Health Sciences. In addition, I am a member of this esteemed faculty here on the stage. I had the privilege of walking alongside of these individuals this summer as we considered what professionalism meant to them and to the doctors and future doctors of physical therapy. And I had the distinct privilege to speak to the significance of this ceremony with you all. So, students, my expectation is that you remember two words, only two words: identity and responsibility. Identity and responsibility. You see, this white coat ceremony marks an important step into the profession of physical therapy. After much hard work to get here and preparation, which got multiplied this past summer, and you succeeded, you are now entering your new role as a doctor of physical therapy student. In a sense, putting on this white coat symbolizes your commitment to take on a new identity. And with that new identity comes significant responsibilities to serve. Your new identity will be as a public servant caring for those in need. And your responsibility is to meet those needs of those in your care. Recently, I woke up with an analogy related to the purpose of this white coat. And I hope this in no way disrespects the tradition of white coating, but I think nonetheless the analogy is consistent with our modern times and gets across this idea of identity and responsibility. The outward sign that we're going to place on you of this coat reminds me of the importance of the suit that our favorite superheroes put on. In a sense, you're going to have a super identity tied to that suit. Who is your favorite superhero? Mine is Flash. And if you recall, don't laugh at Flash. And if you recall, what's the emblem on the suit? A lightning bolt. And why is that? Because it symbolizes his identity that he is fast. We're back in classroom, aren't we? Speed and power. You see, you'll be a superhero in your career as a doctor of physical therapy. This coat represents your changing identity and, again, the associated responsibility. I remember a 9-year-old putting on a superhero suit, essentially bright clothes and a towel for a cape, and this 9-year-old ran through the neighborhood late at night in the dark, protecting his neighbors from danger. This 9-year-old to this day remembers the sense of identity and the sense of responsibility for others as he ran throughout the dark neighborhood. The power of the cape, of the suit. By now you probably realize that 9-year-old was me. May I add that no crimes were committed on this superhero's watch. All that is to remind you that you are now putting on your superhero suit. Identity, responsibility are changing. You now be caring for those in need, and your responsibility is meet the needs of those in your care. You are making a public commitment by coming forward, having your picture taken, that you are now a student physical therapist with a new identity and new responsibility. If you recall, you've heard me say this before, that at the University of Lynchburg, we pride ourselves on being student-centered. And honestly, as the dean, while I fully support that sentiment, I think there's one more important person even than you. And that one individual more important than you is that first patient that you will care for in 2025. And it might be your family from what I understand. So yes, we are student-centered, but I think first in the College of Health Sciences, we are patient-centered. No longer studying for an A or just enough to pass, but rather preparing for your first patient. Again, your identity and your responsibility. So congratulations. Yes, and remember that that coat represents a change in your identity and responsibility, but you're ready. I know that personally. You are ready to wear that coat with pride. Keep it clean. Congratulations. We are honored to be part of your new identity and new responsibility, and we're here to help you become the superheroes that you will become. Thank you.
spend a minute adjusting the microphone here. And maybe someone should tell Dean Smith what the flash has been in the news for lately. But we'll tell you later. Anyway, so normally for this address, I talk about the importance and symbolism of the white coat. However, I go fourth, and so by the time I get here, everyone's already done it. But it's okay, because I have a backup plan. So this year, as we're coming out of some challenging times, I wanted to go a different direction and do something a little more lighthearted, and hopefully still with a direct message that's meaningful. So whenever I prepare a new speech, I spend a lot of time considering what I should talk about that would be of interest to other people. Usually my best ideas come in the middle of a 4-mile run or while I'm driving my daughter to soccer practice in Charlottesville. Unfortunately, in those cases, when I get to my destination, I've forgotten what I wanted to say. This year was different. You see, my wife's a high school math teacher, and every year at the beginning of the school year, she searches for inspirational quotes to encourage and motivate her students. This year, she turned to the internet's ultimate short format video platform, TikTok. So while listening to my wife listen to TikToks on a recent family trip, I decided I would also share some TikTok wisdom with you this evening. To be honest, I didn't really know what TikTok was until about a year ago. I'd probably heard of it, but I wasn't too interested because a lot of other internet fads, I thought had disappeared. But it's here today, so my hope is that some of this wisdom will keep you focused and centered as you prepare to become physical therapists. Before I start, I want to be clear. None of these thoughts belong to me. I borrowed them all from TikTok. I can't take credit or blame for anything I'm about to say, and I also don't want you to think this speech was easy to write. While perusing TikTok for inspirational messages, I was constantly sidetracked by videos of ingrown hair extractions and earwax removal. Yeah, it's weird, I know. Not to mention any number of bizarre challenges, some of which I'm hoping to try later tonight. In fact, if you search TikTok long enough, you can find Dr. Blair's attempt at the milk crate challenge. Do you remember that one? Is that too old? Okay. So here's some TikTok wisdom that I hope will help you on your journey to become physical therapists. All right. Today is going to be a great day. Don't compare yourself to other people. Compare yourself to who you were yesterday. We all love change when it's about changing others, but we're opposed to change when it's about changing ourselves. Be a reflection of what you'd like to see in others. If you want love, give love. If you want honesty, give honesty. If you want respect, give respect. You get in return what you give. When I look at a person, I see a person, not a rank, not a class, not a title. This is my favorite one. It's not about you. Forgive others, not because they deserve forgiveness, but because you deserve peace. Whatever you do, give 100%, unless you're donating blood. Whenever someone says you can't do it twice and take pictures. Don't cry because it's over, smile because it happened. You have exactly one life in which to do everything you'll ever do. Act accordingly. Live simply, love generously, care deeply, speak kindly, and leave the rest to God. Respect your parents. They passed school without Google. Unimaginable these days. You have not lived today until you've done something for someone who can never repay you. Regular exercise keeps you healthy. Use the stairs more often. Never let anyone treat you like a yellow starburst. You are a red starburst. I like the yellow starburst, though. Yeah. Before healing others, heal yourself. Just a few more. The reason most people fail is because they give up what they want most for what they want now. Most of the things you worry about will never happen. Success is not a comfortable procedure. It's very uncomfortable. Get comfortable with being uncomfortable if you want to be successful. Don't sweat the petty things, and don't pet the sweaty things. Say bye to people that don't bring positive energy into your life. Nobody cares what you did yesterday. What have you done today to better yourself? Don't focus on what you think you deserve. Take aim at what you're willing to earn. And then lastly, failure is not final, it's formative. It's part of the process, it's part of the journey. Your failure matters as much as your success. Failure is an event. It's not who you are. Failure is fuel for the future. You have to fail in order to succeed. So that's it. And I hope a few of these resonated with you and that you can, as you take this important step to become a physical therapist. And once again, congratulations. We're excited to officially welcome you to our profession. So, congratulations. Now, I have the privilege to introduce 2014 Lynchburg graduate, Dr. Samantha Foster. Dr. Foster works for a local physical therapy provider, and we're fortunate to have her here with us this evening. Please join me in welcoming Dr. Foster back to the University of Lynchburg.
I'll adjust the mic again. So like I tell my patients, please call me Sam. I knew exactly where my white coat was when I went to iron it this morning. I have worn this coat far beyond the white coat ceremony. It's, to me, a sign, but more of a statement of the hard work that you are putting into school, but also what we as a profession share. We all share the white coat, but we share a camaraderie that I have not experienced in another profession I was in. You see, initially I was a high school biology teacher, needed physical therapy, and then found this profession, honestly, on accident. It was an accident that brought me there. You have made one of the best decisions, and I can tell you from being at University of Lynchburg and being a 2014 graduate, I didn't need to write a speech to tell you from my heart that this college will prepare you, this university will prepare you to do your job. But your faculty will prepare you for your career. Do you see the difference there? You are standing on the shoulders of giants. You are working, and I'm gonna get teared up. You're working with some of the best people in the field, because part of your curriculum, you will travel, you will do clinicals in other states, you'll have the opportunity to travel and do your specialty. I always felt prepared, and my questions came back to faculty even to this day. I took the curriculum and I printed it out, and I said, okay, for the next 2 days in the clinic, I'm gonna think to myself, how much of the curriculum do I really use? And I looked at it today. I honestly use everything you will learn. You will come out of the DPT program experienced and prepared to treat that first patient. But it'll be up to you to take that next step. One of the classes that are intertwined throughout the entire curriculum, ICAL, which is critical thinking, but I want to bring your focus to the professionalism. It's going to be so easy when you become a therapist to go to work and come home, but it's so much more than a job, it's your career. You are becoming leaders in the field, and today I get to welcome you as my colleagues. So one of the things about being a leader in the field is sometimes we have to lean on others. So what I learned, reach out and ask questions. I'm also the co-director for Valley District for APTA Virginia, which is the Virginia chapter of American Physical Therapy Association. Something I do on a monthly basis is send an email and ask a question. One time I sent an email to the middle of America and asked somebody from Rocksteady Boxing, hey, would you be a speaker to present these ideas? And guess what? He gave a 2-hour fabulous presentation. All you have to do is ask. So if I leave you with one thought today, it's to lean on others, not only in the field, but surrounding patient care, because we're here to help. We wouldn't be in this profession if we weren't. So I want you to turn to each other and say, I'm here with you. I'm here to help. It will become so tremendously imperative that you lean on each other. When I gave a speech a few years ago, I said, when you think you're ready to take that test, study 10% more. Well, what I want you to think about is don't study 10% more. Study with someone you don't usually study with. Get their perspective. Because one thing I've learned with becoming a doctor of physical therapy is it takes multiple perspectives sometimes to treat some of the hardest cases to help people achieve their functional goals. With becoming a physical therapist, I think it's also important to know that iron sharpens iron. You're among the best in your field, and I think it's important to reach out and keep learning. The president of APTA, Dr. Roger Herr, stated, "More and more people are realizing that physical therapy isn't only about recovering from an injury or surgery. They're increasingly looking for us for who we are, movement experts. I urge us not to command from behind, but to guide from out in front, to spend as much time as possible focused on where we must be, not where we are." So think about where you want to be as graduates from the DPT program, but know that we are all here to help. From this day forward, anyone who wants to email me or contact me, I'm here to help. And I'm sure it goes for most of the therapists, if not all the therapists, that you will encounter. We are here to help that first patient. We are here to help each other, and we're here to grow in the field. And I welcome you as colleagues. I'm excited to learn with you, and please reach out when you need it. Thank you.
This is a very intimidating position here. We often talk about the therapeutic alliance between the physical therapist and the patient. At some point in the curriculum, you will hear each of us on the stage talk about the importance of seeing the person, not the diagnosis. Understanding a person's lived experience is a part of helping that person succeed. I think we as physical therapists are forever changed by these relationships. You can read the diagnosis about our speaker in your program, but I'd like to speak more about the lived experience of Dr. Counsel. I think many of you can and will relate to his professional and personal evolution. Before he became a physical therapist, Dr. Counsel was an Eagle Scout. Before he became a doctor of physical therapy, he majored in biology and exercise sports science. Before he became an ABPTS board-certified neurologic clinical specialist, he was just a regular physical therapist working in acute rehab who happened to love neurologic practice. Before he became an adjunct professor at the University of Lynchburg DPT program, he served and continues to serve as a clinical instructor. Before he moved out of his comfort zone and into outpatient practice, Dr. Counsel was a leader in acute rehabilitation in Centra's Virginia Baptist Hospital. Along the way on this professional journey, Dr. Counsel met and married his amazing partner and best supporter, Amanda. He and his wife have 4 amazing children, all of whom were born while he was working full-time. He dedicates time to being a leader in his church. He is a huge UNC fan. He has competed with colleagues on work volleyball and softball teams. He's a handball referee. He and Amanda competed in a wife-carrying competition. I'm gonna let that sink in for just a minute. Dr. Counsel has been known to run in the wee hours of the morning before work for exercise and to burst into song on the acute rehab unit while walking with patients. The jokes that he uses to start his lectures are legendary and often involve rutabagas. Dr. Counsel brings all of his lived experience into every interaction he has with patients, colleagues, family, and friends. He sees every interaction as an opportunity to learn and grow, and he often approaches every day with the mindset, how can I make things better? And that's a rare thing. I've been so lucky to have this amazing person as a colleague, both in the clinic and the classroom, as a partner in crime, a role model and mentor, and a lifelong friend. The white coat ceremony symbolizes the beginning of your evolution into the profession of physical therapy. I can't think of a better person to look at as a guide for this journey than Dr. Lamont Counsel.
Dear class of 2025, that's awesome. It's got a great ring to it, doesn't it? Well, first of all, what is the leading cause of dry skin? A towel. All right, now, there are 30 cows, 28 chickens. How many didn't? A little louder? 10. Good. 30 cows, 20 of them ate chickens. How many didn't? 10. All right, now, I did not get asked to be able to just tell you jokes, but I was invited here to be able to talk with you about this wonderful profession that you have chosen, and the work that you are going to do for your patients and for their families. So first of all, I want to let you guys know you've made a terrific choice. So breathe easy, it's all good. You made it through the first semester. All right, and when you think about the patients that you treat, their families, all that you will teach them, your future coworkers, how you'll learn and grow and interact with them, and the places you will go, there's a lot to be excited about. So smile, breathe that in, just relax a little bit. If you look at the opportunities that you will have as PT students, it is pretty amazing. You know, you think about some of you will be going to Italy to be able to study art and anatomy. There's going to be potential service missions in international locations, not to mention clinical rotations in all of the different states of our country. Now is the time, and many of the doors that you're able to step through. But if you look at our profession of physical therapy, look at the history where we've come from. According to the Encyclopedia Britannica, physical therapy in the modern age appeared to have started in the 19th century with the promotion of massage and manual muscle therapy in Europe. In the early 20th century, approaches in PT were used in the United States to evaluate muscle function in those people that were affected by polio. Physical therapy developed programs to strengthen muscles where possible and help patients with polio learn how to use their remaining musculature to accomplish functional mobility activities. Also around the same time, though, physical therapists in the United States were also trained to be able to work with soldiers who were returning from World War I. Back in those days, physical therapists were known as reconstruction aides. Some of the reconstruction aides worked in hospitals close to the battlefields in France to begin early rehabilitation of wounded soldiers. They often worked with patients who had amputated limbs, head injuries, and spinal cord injuries. From these roots, our profession has grown into one today where physical therapists work in a variety of settings, such as private practice clinics, hospital, inpatient and outpatient clinics, skilled nursing facilities, home health, the military, school systems, aquatic therapy, or you can work with sports teams. There's even hippotherapy. No, that's not providing physical therapy for hippopotamuses, but it's providing physical therapy while working with horses. You will get to try different techniques such as PNF, NDT, dry needling, body weight supported treadmill training, functional E-stim, vestibular rehab, to name a few. Some of you may decide to join the ranks of the faculty up here and be able to teach. There's other of you that will have a desire to become a clinical researcher, where you decide where you be able to look at which treatments are most effective or what's the best practice patterns. The sky is the limit. However, the one thing I want you to understand is that you're already along this path that you started in June. You know, over the next 2.5 years, you'll be laying the foundation for yourself as you learn information, as you implement ideas and techniques, as you develop your treatment philosophies that will help set you up for the rest of your career. In your class, you all come from different walks of life and different majors, including communications, sociology, business administration, allied health, exercise physiology, nutrition, sports medicine, biomedical sciences, and interdisciplinary studies. You guys are a well-rounded class. And you all have come together in this journey, and you will continue to move to make a difference as you move from this point forward. Notice that I said from this point forward, not when you graduate from school. The time is now. It's going to be a common theme we're going to talk about. I have a story about one of my former patients named Gene, who's given me permission to share his story and show the footage which will be shown in the next few minutes. Gene was a man in his late 50s, early 60s, who had severe low back pain after a couple of his lumbar discs were pressing into his spinal cord, causing him to have severe pain. And he had surgery to address this issue, but after the surgery, he lost the ability to use both of his legs, unfortunately at first. After staying in Lynchburg General Hospital and then coming over to inpatient rehab over at Virginia Baptist Hospital, he was a total for 1 to 1.5 months of therapy. And with treatment from the doctors, therapy staff, and nursing, he developed some strength in his left leg. He regained about 60% of his normal function in his left leg. But he only had a very small amount in his right leg, and he needed bracing, a long leg brace, and to be able to stand up, to turn, to get into the car. But mostly he got around using his wheelchair. He went to outpatient therapy in a couple of locations, but found out that he had to have a limited amount of visits, and he had to stop his physical therapy due to insurance, and the fact that the rising out-of-pocket costs he couldn't cover being able to go to therapy. But you know what? Gene didn't give up. He asked around for different places, and then he was referred to the Lynchburg College Community Health Clinic, which is now today the University of Lynchburg Community Health Clinic, where he worked with many DPT students like you, and they were under the supervision and guidance of Dr. Anissa Davis and Dr. Terry Leahy. In 2 years' time, post-injury, Gene progressed to walking with a rolling walker and looking like this. He is flanked on his side by 2 physical therapy students, just like you all. Over the next year, Gene attended the community health clinic. He worked with students and faculty and worked hard. He did the exercises in their clinic, and then he progressed to being able to this next point, where you can see in our next video, where he's walking with axillary crutches. We won't have you analyze his gait right now, but the point is you see that he's progressing, and he's made a lot of progress, and you see another class of students are right beside him. Thank you. Today, Gene has progressed to the point where he can drive, negotiate stairs in his home. He can be able to wash his car. This was a very important goal to himself. He wanted to be able to do that, do it on his own, not have to have his family there holding him. Instead of that long leg brace that you guys saw in the video on his right leg, he wears a smaller brace that only goes from his mid-calf down. It's called an ankle-foot orthosis. He has full use of his left leg. It was made possible by the work that was done by those students who came before you. And now you will have the chance to be able to help other patients to improve their function and be able to regain their normal life. So seeing the potential for change and recovery that you all will have in graduate school and afterwards, I want to share with you 4 traits that will help you not only as you navigate your journey in your education, but also in your career as well. First one, be striving. Challenge yourself. You always want to be moving forward. As you're in classes now, you're here in grad school, you're paying to be here, and you're learning classes, you're in classes that contribute to your major. There's no more general education, no more classes, just to complete a requirement. Everything that you're here is pushing you forward towards being that physical therapist. Strive to be forward. Once you get in the clinic, strive to figure out your exercises. Don't just settle for 3 sets of 10 unless that's what's required, Know what you're doing and know why you want to do it. Second, be courageous. Be courageous when you're studying with your classmates. Be courageous to be able to step up and hold each other accountable. Make sure you're always being honest, that you're always being true, that you're doing those things that you know that you need to be doing. When you're in the clinic, when you're in those interdisciplinary team meetings where you're talking with doctors, nurses, other staff members, be able to step up and say, this is what we should do. Or sometimes it's, no, we need to be able to make a course correction. And we need to move in this direction. Be courageous. Also, courage is sometimes when you're talking to your patients. You want to be optimistic, yet realistic. You want to be the person that gives them that hope to be able to, yes, you will be able to move. Yes, you will be able to get up and walk, potentially, if that's. But sometimes it's, no, we're not able to walk this time, but let's go ahead and learn how to be able to move in this wheelchair and how to be more effective. But the thing is, you have to have that courage to be able to know and have that vision as well. Third, you want to be resilient. In neurology, there's different times where people have what's called hemiparesis, or they may lose half of their body. They lose the ability to move their arm. They lose their ability to be able to use their leg for a time. We have a saying on our floor, can't is not an option. You can say, I'm having difficulty moving around, I'm having difficulty getting around, but can't is not an option. And where your resiliency will show itself is as you go through their treatment patterns. In neurology, we may have to stand that patient. We help them weight bear. That weight bearing is what helps them be able to get that return of function as they do that, it may take 1 week, it may take 2 weeks, but having that resiliency, telling them you're getting up each day, striving to work, that's what's going to help them improve. Also, there's a quote from Dr. Martin Luther King Jr., and I've tweaked it a little bit just to be able to include everybody. It says, "The ultimate measure of a man or woman is not where he or she stands in moments of comfort and convenience, but where he or she stands at times of challenge and controversy." Be resilient, always step up, and be able to be the cheerleader for your patients and their families. Fourth is to be humble. You have to, in physical therapy, you get to learn from people from all walks of life. There's some people that agree with you, there's some people that disagree with you. But that's not what gets checked at the door, those personal opinions. You step forward and you treat them to the best of your ability. Use your knowledge, use your skills, use your empathy. Be able to help them believe in themselves and help them be able to improve. Sometimes, humility happens because we choose it. Sometimes it happens because, it's brought upon us. When I was in high school, I was 5'3" and 102 pounds. And, I thought I wanted to be a pro basketball player. Well, reality set in, and I got cut from the JV basketball team. And so my mom pulled me aside, and she's like, "Son, I love you, but you're not going to be a pro basketball player." And not because I couldn't be, but just because she knew my work ethic and as far as basketball was concerned. And so she gave me a library book that had a bunch of medical careers in it, and she told me to read it. And so I did read it. And I saw this career that talked about physical therapy, and I'm like, I like to play sports, I like to be active. Let's see, and I like to help people. Let's see if we can put this all together. And through volunteering in high school and volunteering in college, I was blessed to be able to find a career that allows me to be able to grow and allows me to be able to help other people. Be grateful. I think it was Dr. Smith who stole my thunder when he had you all stand up and look at the crowd. Be grateful for the work that has been put into you to be able to help you get where you are. Don't forget those people. Don't forget your family on those tough days. And they will, and like I said, I love PT school. I'm blessed to have been a member of the faculty for the past 7 years. And, there's going to be hard days. There's going to be days where you're going to want to quit. There's going to be days where you're like, I don't know if this is right for me. That's where you lean on your neighbor. That's where you lean on your family. You lean on your friends. And know that you can do it. I can testify to you that you have a faculty here that loves you. I know most of them. I've worked with a lot of them. And they care about you, and they will be there to help you. Notice I said help you. They won't do it for you, but they will help you. They will help you along the way, and they will help you to succeed. So remember this. Be striving, be resilient, be courageous, be humble. As you do this, as you put on these white coats, as you say this professional oath, and you step forward, you can do it. And we believe in you, and we salute you, class of 2025. Congratulations.
Hi, I'm Dr. Jeremiah Blankenship. It is my honor to read the names for our students today. This is a very special class. They demonstrate a high level of scholarship and inquiry and interest in what they're doing, and I've had the pleasure to work with them for the first 2 semesters that they're learning, so pretty excited to be up here. I'll call everyone's name. We'll stand as a row, and then when I call your name, you can go in first row, can stand. As I call your name, you can come up. And then they will receive their white coats. Abet Bandari. Colin Brooker. Hunter Cassidy. Connor Christensen. Maverick Coleman. Taylor Kraft. Bradford Davis. Andrew Dirth. Sarah Dillon. Amber Evans. Rowena Flowers. Rebecca Flowers. Kiesia Payne. Caitlin Greer. Ryan Hamaker. Haley Hatter. Teo Hu. Connor Lafort. Paul Mahaffey. James Mankus. Crew McCarthy. Leanne McCormick. Abigail Michelson. Elena Middleton. Braden Moore. Chelsea Moran. Megan Partain. Lauren Pascadlo. Kaylin Frame. Abigail Perkins. Samuel Procopio. Colton Schnars. Alexandra Searles. Bailey Thomas. Matthew Thomas. Alec Vandy Muellerbrook. Joe Chin. Austin Witcher.
Coming back, I promise. Alrighty, so we will now read the professional oath. It should be on the back of your programs. If you're a physical therapist, please feel free to stand and recite the oath with us. So I'll start off a little loud, then I'll get quiet, but you guys take over, okay? All right, good. All right, you ready? All right, in the presence of my colleagues. class vice president, Bradford Davis, offers his closing words, I want to invite the students and their guests to join the faculty and staff for refreshments in Shule Hall following the ceremony. Just follow everybody else. The refreshments were provided through a generous donation by Medical Facilities of America. I also want to remind the students stay where they are following Bradford's closing words so the university photographer can take another official photograph with the faculty to commemorate the ceremony. And I would like to ask our guests to exit through the side doors over there after the students recess to the back of the chapel so that we can take another group photo out there. You'll be able to take a group photo too, but we'll also make the photos available to family members as well. But if you'll just give us the space to take the photo, then you can get them behind them, and we'll stay there for as long as you want. And then lastly, I want to offer a special thanks to the School of Physical Therapy staff members, Max DeVille and Whitney Grimm, for organizing the ceremony and reception and ensuring that everything went smoothly. Thank you very much. Now for Bradford Davis.
Dang, guys, we look good in some white. I thought my sleeves weren't going to be long enough, but I think we're good. Good evening, everyone. My name is Brad Davis, and I have the pleasure and honor of being this class's vice president. I want to first start by saying thank you to all the loved ones who have traveled here today to share this special milestone with us. You can feel the warmth and respect in this cohort, and I believe that credit goes to y'all. The apple doesn't fall far from the tree, and we got some good apples here in Lynchburg. One thing I've realized about physical therapists is overall, they are some of the nicest, most patient, eager to learn people on this planet. You see it in our faculty every day when we come to class, and you also see it in the 38 people here receiving white coats today. The focus and enthusiasm we all share is contagious, which is making this a better experience than I ever thought this would be. On top of being great students, we also have quite a few retired college athletes in the cohort. For me, my soccer background, fear of running, and an absolute cannon for a right leg made me perfect for one position in sports, place kicker for the football team. My leg landed me on the football team of my hometown school, Old Dominion University. One moment I will never forget playing for ODU. All Hokie fans might want to cover their ears for this one. 2018, during my redshirt sophomore year, overcoming a 1.8% chance of winning, the 0-3 Old Dominion Monarchs took down number 13 in the country, Virginia Tech, 49-35. And just last Friday, they did it again, beating them 20-17. Go Monarchs. But during those years kicking footballs, the biggest lesson I learned was I realized everybody on this team is completely different. We all had different specialties, different strengths, and different weaknesses. But we all did our role, trusted one another, and got the job done. We were a team. This class reminds me a lot of that, a smorgasbord of unique characters. I first realized that this class was a team was during our first day of professional practice class. Dean Smith gave us an assignment to figure out what color or personality we all were. Afterwards, we soon realized that our class was full of colors. Like if this class was a painting, it would be a mixture between Bob Ross and Picasso. That personality assignment that Dr. Smith gave us had me thinking, while we subconsciously may label everything as right or wrong, let's often take a step back and realize that we are all different. With professionalism being the common ground, understanding the differences in the individuals of a team is a fundamental skill that every professional should have. Immediate group work with all these new strangers put us in uncomfortable situations. While I used to dread this, Dr. Smith gave us a new perspective. Through these times of awkwardness and tension, there is learning and there is growth. In these quick 3 months of learning and growing, I can already tell this colorful class of 2025 is on track to do some very special things. Alongside Sarah, who I just met, and I can already tell is just the most awesome human being alive. I'd go as far as to say that if she ran for President of the United States, she'd have my vote. But until then, I foresee us, the rest of our office, and the rest of this class as a whole being very successful during our 3 years here in the DPT program. I'll leave you with this. Just before coming here to Lynchburg for our first summer semester, my mom gave me a hug, and then before I left, she stopped me. She said, "Hold on, Brad, one more thing. There's power inside of you. It's all inside of you. All you have to do is reach in and tap into it. God placed the power inside all of us, and when we start to tap into that power, and we keep working as a team, and we keep respecting people and accepting people, we're all going to do great, great things. Thank you so much.